Hi and welcome. I'm trying to learn medicine. Today, aortic incompetence, and after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, then it's at your own risk. And this is about the blood system and a disease. And this is in no way a medical advice, we're just learning about it. Aortic incompetence. The aortic valve lies at the exit of the main pumping chamber, ventricle, and should close after each heartbeat, preventing the backflow of blood into the heart. Okay, they're talking about the left ventricle? Yes, out of the left ventricle there comes the aorta out. And that aorta has a valve, and normally after the heart has pumped the blood into the aorta, the ventricle closes and now blood can flow back. The blood is then in the aorta and comes into the body, and it doesn't flow back. Now, if there's a problem with this valve, with this closing thing of the aorta, then the blood can flow back, and it is not so good given into the body. When diseased with aortic valve, the valve becomes thickened and does not close adequately. Blood leaks backwards and causes pressure in the heart. Causes pressure. As well as being incompetent, the valve may be narrowed, that is when stenosis. We have it as the next thing. So it can be narrowed when it is stenosis, when it doesn't close properly, but it can become also thickened and doesn't close also properly. Whatever. Symptoms. In mild cases, there are no symptoms and the condition goes undetected. Certainly, at least a little bit diminishing in the ability to do physical activities. So in mild cases, there's no symptoms and goes undetected. And then, I think I understood it now, the symptoms are listed in severity, I think. Maybe in this book. The next thing is shortness of breath. Occurs when there's a large blood leakage. Causes. Rheumatic fever as a child. That is interesting. There are a lot of diseases and problems in the human body which happen because there was previously an infection. Who knows how many things there are in the human body as diseases and problems, but we don't know yet that there is some type of infection previously responsible for it. We already know about so many things. For example, about the aortic incompetence. Do we know that rheumatic fever as a child can cause it? And also, sclerosis or hardening of a valve can be a cause. So sclerosis, I'm not sure of what type of sclerosis, but it could be that they all are the same, that they are all about the nervous system. Lateral sclerosis, that would be that the muscles stop working over a few months and years. Multiple sclerosis is also of the nervous system, and I don't really know how that works. But there's survival with it is longer, and there's better treatment. Sclerosis or hardening of a valve. And infections can be also a cause, and congenital abnormalities of the heart, so inborn things. Treatment in the home. Avoid exertion causing shortness of breath. The treatment in the home, do we mean not how to treat it, but basically how to live with it in this case. Avoid exertion causing shortness of breath. When to consult the doctor. If undue breathlessness occurs, and again, this is no medical advice, we're just learning. When to consult the doctor if undue breathlessness occurs, so if there's breathlessness. What the doctor might do, try to treat the breathlessness with drugs. The diseased valve may be surgically replaced depending upon the patient's age and general health. Okay, now first of all, looking what the causes of a breathlessness, and when there seem to be some drugs to help, some medicamentations, and when there are also surgical options. Prevention, none do they say, but if it is caused through rheumatic fever. What is rheumatic fever? Maybe we're going to come to it when we are at R. Maybe that is not an infectious disease, but they say no prevention, but who knows. where we're going to find out more. Outlook. A slight blood leakage makes little difference in the quality and length of life of a sufferer. A larger leak may lead to heart failure, but this may be controlled by drugs. Surgical replacement of a deceased valve improves the outlook considerably, but fibrillation is not without risk. Okay, as I said, if it's just a little problem, a little blood backflow, then it's small, it's no problem. If it is more, then it can cause heart failure, but there are drugs making that more unlikely. And if a valve is surgically replaced, then it's all over better, but the surgery is a bit... What is the word of it? Demanding. But it doesn't work for in that case. It's not without risk. Now that was the aortic impedance. I don't understand the word incompetence. If it would be incomplete, I don't understand the word incompetence. And I think it's just a normal English word just to do not understand it. Incompetence, aortic incompetence. Now that was the medical part. If you were here for medicine, anything out directly to the next part, we will do now short impingement training. If you participate in the short impingement training, then it's better. Let's go. Go to step stance, and we're doing forward shoulder circuits. Go back, up, front, down. And again back, up, front, and down, and now backwards. And now, long arms, strong fists, and go as far back as you can with the shoulders. Go high up, either front, down, again, back, up, and front, and down, and again, up, and back, down, front, up, and back, and down. And now, the world lifter. Long arms, strong fists, and go shoulders down and together, and turn the arms to the inside. Now the arms to the outside, shoulders down and together. And change. Arms to the inside, shoulders all the time down. And then arms to the outside, shoulders down. Together. And release. No. Arms to the side, hands from the fists, mid in front. Turn the arms again in front, shoulders down, hands together. And change. Arms back, shoulders up, and in front. Change. Arms in front, shoulders down, and together. And the arms back, last time, shoulders up and in front. And release. Now we shock, just lift the arms up, and shock shoulders up, and release it all down. Again the arms up, shock shoulders, and all down. And the last time, arms up, shoulders up, and all down. Now press the curl to loosen all up and to observe what the scapulars are doing. To the outside with fists and again together. Down and to the outside. That is already the last time. Now we're doing the sun dive. You can also use a tennis ball or whatever. Have a long arm at the outside. Let it fall down. Try to catch it again. Then wander slowly in front. And on the other side. And now stretching. One arm in front. The shoulder is back and down. Pull the arm in. Have flat fingers. Try to relax the arm. Go a bit back with the shoulder. And turn the palm up to the sky a bit. Now we are arm. Take the arm in. Shoulders back and down. Pull the arm in. Have flat fingers. Try to relax the arm. Go a bit back with the shoulder. Turn the palm a bit up to the sky. And it was the shoulder bit training. I thank you very much and until next time.